be here with you today to talk about registered dietitians. I became inspired to pursue a career in dietetics back when I was actually in high school, quite a while ago, when I had jaw surgery actually. So I was born with some issues with my jaw, and during that time I had to have my jaw wired shut after having surgery, and I was under the care of a dietitian who looked at kind of maximizing or improving my nutrition to maintain my weight, keep my protein up, maintain my good health at that time. And I found that very interesting, that how important the nutritional aspect of my healthcare was. And so I did become inspired at that time to pursue a career in dietetics. And so when I was applying to universities in my last year of high school, I applied all over and considered a career in a lot of different health fields, including nursing, physiotherapy. But I did apply to a few nutrition programs in Southern Ontario, as well as the University of Manitoba in Winnipeg, Manitoba, and I ended up going there. So I completed my 4-year undergraduate degree in food and nutritional sciences. To become a registered dietitian, in my 4th year of my undergrad, you apply for an accredited internship. So internship programs, there are many throughout the country of Canada. So I attended my undergrad in Winnipeg, Manitoba, but you can apply to any of the programs across on Canada. There is a process, I'm not sure if it's the same now, of you can only pick 3 at a time. There's a ranking system, and I actually didn't get my internship the first year that I applied, which at that time was quite discouraging. I did have the great opportunity to attend or to participate and apply to a new fledgling program at that time, again, a number of years ago. That did eventually turn into the NOSM, what they have now at the NOSM Medical School, as their NODIP program, so the Northern Ontario Dietetic Internship Program. So I was able to do my internship here in Thunder Bay and in the district and surrounding area to complete. So internship programs range anywhere from 10 to 12 months and include a variety of placements in different areas of healthcare and dietetics. So you will see dietitians working in a variety of areas, including public health and community, food service, hospitals, clinics, etc. So I always knew that I wanted to work in the area of outpatient care, or work particularly with patients, and so I tried to tailor my experience in my internship as much as possible to maximize my experience that way. But there are a number of set placements that you do have to attend in order to, achieve the accreditation part of the internship. After that, the internship is meant to prepare you along with your schooling for the exam. So you do a registration exam to become a registered dietitian. And then you apply to become part of the regulatory college in the province that you live. So I belong to the College of Dietitians of Ontario, and as such, as a regulated health professional, they are my regulatory body. Yearly, we complete goal setting and go through different continuing education to sort of keep up our skills in the same way that all other regulated health professionals, including doctors and nurses and such, also do. So as I mentioned, I've worked 18 years. I've worked in a variety of different settings here at Thunder Bay Regional, and from a clinical standpoint, I've worked in cardiac, I've worked in renal, I've worked in maternity care, I've worked just sort of what's called general medicine inpatients, patients needing enteral or parenteral nutrition, where you may have seen tubes down feeding patients, or through the vein is another way that we feed. So I've worked in a variety of areas. For the last 11 years, I've worked here at the Regional Bariatric Care Center, where we provide treatment for patients struggling with the disease of obesity and many other chronic diseases associated with that. So my day-to-day is filled with patient care. So I deal directly with patients, outpatients who are pursuing bariatric surgery. And so there's more information online about bariatric surgery if you're interested in learning more about that. There's an Ontario Bariatric Network. There's Obesity Canada, which can provide a lot more insight into the type of things that I do from an obesity perspective. But I do work with patients. We talk about nutrition, healthy eating, from a weight management perspective, as well as specifically preparing them for bariatric surgery and also monitoring them after they've had surgery. So we follow our patients for 5 years. And so my days are spent, again, working with patients, goal setting, meeting with the team that I work with, which it includes other members of the healthcare team like physicians, surgeons, nurses, social workers, psychologists, registered kinesiologists, to name a few. I hope I'm not forgetting anybody. And so we work together to provide care to patients in that specific way. I think if you're looking for more information on becoming a dietitian, there is easy information that you can find online through places like Dietitians of Canada. You can also find under the NOSM website, under the Education tab, there is how to become a dietitian, a registered dietitian, as well as information on their NODIP internship program. You can also find information about becoming a dietitian on the College of Dietitians of Ontario website. And certainly, as I mentioned, my name is Sarah Miller. I'd be happy to answer any questions. If you wanted to connect with me directly through some of the organizers of this program, I would be open to that as well. So I hope that you have found this interesting, and good luck in all your future endeavors.